Vitamin supplements. What should we be taking and how much? We'll talk to an expert about vitamin D. Plus, learn how your supplements could interact with the other medications you're on. It could be dangerous. And then a vitamin-rich recipe for a hearty soup. We'll talk to a dietitian about adding vitamins and minerals into your diet every day.
Your health questions answered. Welcome to Healthy Living, brought to you by the experts at Essentia Health.
Welcome to another edition of Healthy Living. I'm Michelle Lee. The vitamin aisle at the pharmacy or grocery store is packed with options, but it can be hard to know what to take and how much. With vitamin supplements, more is not necessarily better, and it's worth having a conversation with your doctor about your own health needs. In general, the physicians in Essentia Health's internal medicine department say multivitamins are not necessary as long as you have a well-rounded diet. But they often don't discourage their patients from taking a multivitamin if they want to. There are some medical conditions, like having weight loss surgery or other nutritional concerns, that would warrant a recommendation for a multivitamin. Dr. Jim Jorgensen, internal medicine specialist, does recommend a supplemental vitamin D, 1,000 to 2,000 units per day, to most patients. He says vitamin D deficiency is common, and there are several proven benefits of vitamin D supplementation. Folic acid should be taken by women of childbearing age who think they could get pregnant or who are trying to get pregnant. Not recommended for daily supplementation, vitamin C, vitamin E, or vitamin B unless there's a B12 deficiency. But if you really want to take extra vitamin C or B, talk to your doctor. He or she may give you the go-ahead. We'll talk more about the importance of a well-rounded diet later in our show, but first, let's take a closer look at a vitamin that's generating a lot of attention right now, vitamin D. We're joined by Dr. Michael Slag, an endocrinologist at Essentia Health. Dr. Slag, thank you very much for joining us today. Why is it so important for us to take vitamin D?
Well, vitamin D is an essential part of our body function. Vitamin D is found in the lowest creatures that swim in the ocean, and so it's essential for immune function, for many other cellular functions. We learned during the Industrial Revolution, when people moved to cities and out of the sun, that their bones softened and they developed rickets. And that was the first understanding of the importance of vitamin D on the skeletal system. Since then, we've learned that it does a lot more than that.
So what are some of the ways we can get our vitamin D?
Well, the natural way would be sunshine. If we're out in the sun in most of the country, especially or the world near the equators, we'll get everything that we need. Unfortunately, if you live north of St. Louis in our part of the globe, you don't get enough vitamin D from the sun for at least 6 months of the year.
And typically, is there a sweet spot in that sunshine where we should be getting it?
Well, there really is. It has to be in the middle part of the day. The atmosphere breaks down the ultraviolet rays that convert or cause us to make vitamin D. And so you have to be out from 11 in the morning to 2 o'clock in the afternoon, and you have to have at least your face exposed and your arms exposed, that much of your body. The interesting thing is that we age, when you get over the age of 60 or so, your skin becomes less effective in converting the sun into vitamin D. So there's issues even related to our own internal bodies.
Is there a time period during those hours that we should be thinking about 15, 20, 30 minutes, or do we need to be out the whole time?
No, if we only need about 10 to 15 minutes, as long as the sun is out. If it's cloudy, we'll lose about half the value of that.
Okay, and the next question, are there a lot of Northlanders who are vitamin D deficient?
Well, I think if you were asked to bet on that, you could bet that about 80% are deficient in the winter and about 50% are deficient in the summer.
So who should be taking a vitamin D supplement? First off, are they effective?
They are effective. That's been very well proven as long as you're getting a reliable source, and I think most of the things that we would buy in our community is reliable. People who have known vitamin D deficiencies, so for example, intestinal disorders, if you have like celiac disease or pancreatic insufficiency, for sure you'll need vitamin D because it's fat soluble and those organs are helpful for that. If you're overweight, obese people for some reason are more vitamin D deficient than thin people. If you work inside all of the time, you're not in the sun at all, you probably need vitamin D supplementation.
And when should you get your vitamin D level tested? Is that something we should all consider if we live here in the Northland?
I don't think everybody needs to have a vitamin D level. It's expensive, and we know that the majority of people probably should be taking a supplement or ensuring that they're getting it from their diet. Otherwise, I think if you have unexplained bone disease, osteoporosis and fractures, unexplained musculoskeletal pain or aching, or if you have a known gastrointestinal disorder, I think those would be the situations I would want to get it checked.
Mm-hmm. And how much vitamin D should a person be taking? Does it vary as far as our ages, our health?
It's a very controversial question. Well, the question isn't controversial, the answer is. The Institute of Medicine recently has done a big study, and they think that most people under the age of 70 will be just fine on about 600 units a day. If you're over 70, maybe 800 units. That's very difficult to take low levels and bring them up to normal with that degree of supplementation. So many of the endocrine societies, some of which I belong to, look at the research and feel that probably the order of 1,000 to 2,000 units a day is probably better for most people.
Mm-hmm. Is there a limit where you can actually get sick from taking too much vitamin D?
If you get excessive vitamin D levels, you can overabsorb calcium, and that'll cause high calcium levels in your blood. That usually doesn't happen until you get up into the range of maybe 5,000 to 10,000 units a day.
Mm-hmm. And do you think in the future we may learn a little bit more about vitamin D deficiency? I know that we had chatted earlier before we went on the show that we used to talk so much about vitamin C and vitamin E, and everybody was jumping on that bandwagon. Do you think that we might have some hindsight maybe 100 years from now?
Well, I think we will. I think like all other discoveries, people are always interested in finding something that's going to cure many, many things. Right now, there's a lot of associations. There's low vitamin D levels is associated with multiple sclerosis, with colon cancer, prostate cancer, breast cancer, and many other diseases. The issue is they're just associations. When you have 50% of a population that has a low level, and then you start looking for associations, some of those associations will be proven to be true. Some of them will be proven to be just random associations. We know for sure that bones and skeleton need the benefits of vitamin D. We know that it has something to do with our immune system, but exactly what remains to be determined by stronger studies.
So, Dr. Slag, do you take it yourself?
I take it myself. I had my own level measured a couple years back. I was low, and so I do take a supplement.
So it's a good investment if we all consider taking it, I would think.
I think as long as we don't take too much, probably not over a couple thousand units a day, or then take higher levels based upon your levels to make sure you don't become toxic, I think it's a good idea.
Some great information. Thank you very much for your time. We appreciate it. Researchers are working to learn more about vitamin D and its effects on the body. At the Essentia Institute of Rural Health in Duluth, a study is underway that will help to provide further insight about vitamin D. Kim Kaiser sat down with the senior research scientist working on this project.